Today, I need to address something that keeps pediatric nephrologists awake at night: the silent progression of kidney stones in children, often going completely undetected until permanent damage has already occurred. This isn't a theoretical concern, it's happening right now, and the diagnostic challenges we face are allowing preventable kidney damage to rob children of lifelong health. Here's the fundamental problem. Children's kidney stones present completely differently than adult cases, and this difference leads to dangerous delays in diagnosis. While adults typically describe that classic, excruciating flank pain that sends them immediately to the emergency room, children present with vague symptoms that get dismissed as growing pains, stomach bugs, or even behavioral issues. Young children cannot articulate their symptoms with the precision needed for diagnosis. They might just say their tummy hurts, or they might become irritable and withdrawn. Parents and even physicians can normalize these complaints, thinking they'll pass. The misdiagnosis patterns I've observed are genuinely troubling. Kidney stones in children get mistaken for appendicitis, leading to unnecessary surgical consultations. They're attributed to urinary tract infections, and yes, sometimes UTIs coexist with stones, but treating only the infection while missing the stone sets up a dangerous cycle. I've seen cases diagnosed as constipation, with families trying dietary changes for months, while a stone silently grows and obstructs kidney drainage. Let me walk you through the typical progression timeline, because understanding this might help you recognize warning signs in your own child. Stones can exist for months, even years, causing intermittent mild symptoms that come and go. During this time, silent hydronephrosis, swelling of the kidney from blocked urine flow, can be developing without anyone knowing. There's a critical window here where intervention could prevent permanent kidney damage, but that window closes while families remain completely unaware there's even a problem. So, what should parents watch for? Recurrent unexplained fevers that don't quite fit a typical illness pattern. Changes in urination. Perhaps your child suddenly needs to go more frequently or seems uncomfortable urinating. Persistent abdominal complaints that don't resolve and don't quite fit any obvious diagnosis. And here's crucial: urinary symptoms repeatedly dismissed as just another UTI, without anyone questioning why a child keeps getting infections. Recurrent UTIs in children should trigger investigation for underlying structural problems or stones. The imaging protocols matter enormously here. Ultrasound should be the first-line imaging when kidney stones are suspected in children because it avoids radiation exposure. CT scans, while more sensitive, expose developing bodies to radiation that carries its own risks. We're seeing emerging diagnostic technologies that may improve our ability to detect stones earlier with less invasive approaches. But let's talk about what happens when we miss these stones. The lifelong consequences are severe. Chronic kidney disease developing from childhood stone damage affects adult health decades later. Growth impairment from undetected kidney dysfunction can limit a child's physical development. Hypertension developing from early kidney injury creates cardiovascular risks that compound over a lifetime. These aren't minor issues, we're talking about fundamental alterations to a child's health trajectory, all from something that could have been caught and treated if only we'd recognized the signs earlier.